The Collectives Club, in partnership with the Olabisi Onabanjo University Teaching Hospital, OOUTH Shagamu, successfully hosted the 2025 edition of its annual Free Health Screening Week from Monday, August 18 to Saturday, August 23, 2025 at the Collectives Clubhouse in GRA Shagamu, Ogun State. The initiative, which has been sustained for a decade, continues to provide accessible and life-saving healthcare services to residents of Remo and neighboring communities. It is designed to promote preventive medicine, encourage early detection of illnesses, and reduce the burden of healthcare costs on families. The program was formally flagged off on Tuesday, August 19, with an opening ceremony attended by government officials, medical professionals, and community leaders. In his address, Engineer Wale Ogunsoya, president of the Collectives Club, reaffirmed the club's commitment to giving back to society, stressing that good health remains the foundation of a productive and thriving community. Similarly, Dr. Mrs. Bumi Fatugashe, Chief Medical Director of OOUTH, encouraged participants to embrace preventive care and regular medical checkups, noting that initiatives such as these are critical in reducing avoidable health complications. Throughout the week, hundreds of beneficiaries accessed a wide range of services. These included blood, HB, PSA, diabetes and cholesterol tests, malaria screening, and general consultations. Residents also benefited from eye examinations, with many receiving free reading glasses, while dental care sessions offered cleaning, whitening, extractions, and other treatments. Essential medicine were distributed, and several individuals were shortlisted for cataract surgeries. Each day began with the morning prayer, setting a hopeful and communal tone. Over 300 participants daily taking advantage of services. One of the major highlights was the high care intervention led by Dr. Awude and his team, who carried out detailed eye examinations and distributed corrective lenses to individuals who had long suffered from impaired vision. Equally impactful was the dental care session spearheaded by Agbabia Kadik Joke and the Ofada Medical Outreach team. Beginning each day at 11 a.m., the team provided professional dental treatments that improved both oral and personal confidence. Urgent medical cases were also promptly identified and attended to with swift interventions, preventing further complications and underscoring the life-saving nature of the program. The week-long outreach came to a close on Saturday, August 23, after successfully reaching hundreds of beneficiaries. During the closing session, participants were once again reminded to take their health seriously, prioritize preventive care, and schedule regular medical checkups. Barrister Wale Ajetumobi, chairman of the Health Week Committee, delivered a heartfelt vote of thanks, appreciating the support of Olabisi Onabanjo University Teaching Hospital, Codex Pharmacy, club members, community members, volunteers, and the people of Remo, whose participation ensured the success of the event. With the conclusion of its 10th edition, the Free Health Screening Week has once again demonstrated its lasting impact as a vital community health intervention. By bridging gaps in healthcare access and providing relief to families, the program continues to strengthen the collective well-being of the Remo society. The Collectives Club Remo reaffirmed its commitment to sustaining the initiative annually, ensuring that residents will continue to benefit from essential health services free of charge.
The Collectives
We are here on behalf of the Collective Club Shagamu and they have been doing this annual program for the past 10 years. I was here last year in company of Her Excellency, Engineer Noimot Salako Oyedele, to declare the gathering open. It's a good thing that they are doing. And you know that His Excellency's mission is inclusiveness in patient-centered care. The government cannot do everything alone, and each time they come out like this, a lot of people benefit. And we also highlight the good things that His Excellency have been doing for Remo Line in particular. We have a Gateway International Airport, which is going to become like an aeropolis, like a city on its own as time goes on, because there's going to be so many services surrounding that international airport. Apart from that, His Excellency has passion for health, for education, and for road infrastructure development. They call him Mr. Roads at one time or the other. So we thank him for all the good things he's been doing for the good people of Ogun State. Thank you very much.
Collectives Club Health Week is a program that we have set up for the past 10 years. And the initiative, the idea is coming from the fact that the government cannot do it all. We always need the society also to step forward. And as far as we are concerned in collective, we scan all of this among all the CSR programs we are doing, including empowering youths, including training with ITF. We thought this health week will go a long way, to help our people. Definitely security and then health is what any citizen wants, any society requires to be able to thrive economically. So this is a program that we truly cherish, is very dear to us, and we think is impacting the Remo people and Ogun State at large. You can see clearly here we have the representative of the governor, we have the representative of the deputy governor, and we also have the representative of Akaribu, the paramount ruler of Remo. So that's how important this program is. And you just need to go into the society in Remo and see how appreciative people are, of this program we're doing. If you hear the comments that was made, every year around town they're asking us when is the next program. And this program is unique. There are different types of charity health program that is held across the country, even in Remo, and they're all helping. So what we have just done in collectives in our health week is we're taking it from diagnosing the patient, prescribing drugs, and those drugs we're providing it free of charge, and where additional help is required, including surgery, we take it up with Olabisi Onabanjo University Teaching Hospital. So you can see we're covering end to end. It's one thing to diagnose a patient that is sick. It's another thing to be able to provide them the drugs that they need to become healthy. And there is a different level of providing the surgery that they need. So what we are doing in collectives, we are covering end to end. And I think that's one because unique in Remo, in the society, including other health charities that is provided in Remo. And of course, people are always yearning every year to make sure that we repeat this, and we'll continue to do it. The government of Ogun State, as I said earlier, have always supported us. They know exactly what we are doing, and they appreciate it because, as I said, the government cannot do it all. In the society we are, where there is not enough resources for the government, even in developed countries, you have the society, you have people coming up and stepping forward to help the society. So definitely Ogun State government recognize what we are doing. The local governments in Remo understands what we are doing. And as far as community is concerned, that's why you saw the representative of Akaribu here. Even Akaribu is a member of this club. He's the chairman of our board of trustees. So the society knows what we're doing. But guess what? Collectives is funding this 100%. Many of us, we are thanking God for what He has done for us. And the way we can give back is what we're doing. Every year, members, 40 plus and counting, are stepping forward. We have members providing all the kits to do, all the diagnosis tests. We have members sponsoring the eye clinic, including diagnosis, including providing free glasses for those that need it, and even eye surgery at the end of the day. Those that we think need eye surgery, that is being done by one of our members. And we have members that provided the free drug that we're using today, as you can see it. So definitely from the government to the society, they appreciate what we're doing. And us in collectives, we are stepping forward to make sure that we continue to support this program.
While I'm here, I've been here at the beginning of the medical mission. On Tuesday, there was a lot of turnout. A lot of people were here, and we're so glad that this kind of missions are in place. Before this week, we had the Youth Day on August 12th, and we did some health screening at that place, and we found some people who needed health follow-up, but we didn't have the full facility, so we referred them to come to this event, and some of them came, which I'm very proud of them. But this kind of mission and outreach is very essential. I commend the collectives for putting this together, and it takes a lot to do this. I also commend the people for turning up and prioritizing their health. So health is wealth. Prevention is better than trying to cure it. So we're also educating people as needed, on why it's important to take care of their health and know their numbers. We're also teaching them that diabetes is not like malaria. When the medication is finished, it doesn't mean the diabetes has disappeared. It's a chronic condition. They need to continue to follow up and take their medication. And also talk about diets and those kind of small adjustments. But we also have pediatrics here, lots of children, and the adults. We have the eyes yesterday and today, and we also have the dentist. So it's a full care. And I'm so proud of our people for putting this together. It's my pleasure to be here in my hometown, Shagamu, and giving this back to the people. So I'm grateful for all the organizers and every volunteer, and thank you for coming as well to feature this program. More of this to come, because we need to keep going and doing on a larger scale.
Wọ́n announce ẹ̀ nù káàkiri, wọ́n gbé mọ́tò, wọ́n announce ẹ̀, wọ́n dẹ̀ tún da pépà sílẹ̀. Dókítà yẹn wọ́n gùdù, wọ́n fún wa lóògùn, wọ́n fún wa eye drop, wọ́n fún wa ní glass, gbogbo nǹkan tá complain náà fún wa lóògùn. Wọ́n dẹ̀ ṣe dáadáa fún wa, wọ́n attend wa dáadáa. Mo dúpẹ́ lọ́wọ́ àwọn alákòóso ètò yìí, Ọlọ́run á ràn wọ́n lọ́wọ́. Wọ́n á máa ga wọn ní ìrẹ̀lẹ̀, Ọlọ́run á dá àwọn ọmọ tí bọ́n ṣe ṣàánú wa, Ọlọ́run á ṣàánú wọn, á ṣàánú àwọn ọmọ wọn. Gbogbo ibikíbi tí wọ́n bá dé, wọ́n máa bá láàánú pàdé. Gbogbo àwọn orí tó ń tọ́jú ẹ̀, wọ́n máa ṣe dáadáa fún wọn, wọ́n máa ṣàdúrà fún wọn. Wọn ò ní dààmú, wọn ò ní jàbọ̀ ayé, wọ́n ṣe gan adúpẹ́.
A dúpẹ́ pé Ọlọ́run gbé ètò yìí dìde fún ọmọ ìlú Ṣàgámù, káàkiri ìlú náà ní ìgbọ̀n fún ìlú Ṣàgámù. A dúpẹ́, Olúwa máa ràn wọ́n lọ́wọ́. Ibi gbogbo tán bá rìn sí, Ọlọ́run á ṣaláàbò lórí wọn, ìrànlọ́wọ́ Ọlọ́run á wà fún wọn. Ó pọ̀ rẹpẹtẹ, torí láti àná mo wá torí wọ́n bá mi ṣe ojú mi, ṣe operation ọ̀fẹ́ ni mo ṣe. So eléyìí mi kàn ríran fi ka gíláàsì dáadáa, díẹ̀ pé mi ò ríran, bẹ́ẹ̀ bá fẹ́ ka gbogbo àwọn eléyìí sì mo rí, bá fẹ́ ka Bible, so wọ́n fún mi ní gíláàsì. Wọn ló máa ràn wọ́n lọ́wọ́, ẹnì kọ̀ọ̀kan wọn á ní fi wọ́n ṣàwátì, ààbò Ọlọ́run tó dájú tó nípọn á wà lórí wọn. Èmi pàápàá ni mo ṣe àdúrà nígbà tá a máa bẹ̀rẹ̀ bíbá ìlẹ́ǹkan.
Thank you very much. I actually want to appreciate the role of the collectives Shagamu for what you've been doing. You see, the eye problems that we have is quite enormous in the community. Sure, you understand. And for them to have come up with this kind of free eye screening, free eye surgery, free eye, glasses for the populace is commendable. Hence, on that note, as one of those who are around, I'm one of the Remo indigents. I'm from Ekpara. So to contribute to the community, I said, okay, as a specialist, let me offer my own service to do this. And that's why we are screening, where we are giving free eye glasses through collectives, and we are going to do free eye surgeries for people. There are so many of them that have done one eye in previous, expenditures, previous eye health weeks. So we're going to do this. You see that the crowd is mammoth, but you can see there the product that we brought, the glasses and everything, and everybody is happy. When one person is blind, it affects 20 people, because somebody has to take the person around, somebody has to fetch for that person, somebody has to feed that person, and even the social impact that way you'll be discouraged. And I want to tell you that blindness actually contributed immensely to causes of people committing suicide. About 0.3% of people that are blind, they commit suicide, so which is not too good. So with this very one, when they are integrated, they can now get feedback into the community. Instead of being dependent, they can now assist others, then they can now move around independently. Hence the need. So it's quite enormous and commendable. So it's very wonderful.
So, Sam. So, sir, can we meet you? Starting with your name and your role.
Thank you very much. Good afternoon. Good afternoon. Thank you very much. I'm Dr. Oladapo Gabriel Awude, a consultant ophthalmologist and a public health physician, a rural eye surgeon, and community eye specialist.
Okay, sir, please can you tell us what is your impact in this free healthcare?
Thank you very much. I actually want to appreciate the role of the collective Shagamu for what you've been doing. You see, the eye problems that we have is quite enormous in the community. Sure, you understand. And for them to have come up with this kind of free eye screening free eye surgery, free eye, glasses for the populace is commendable. Hence, on that note, as one of those who are around, I'm one of the Remo indigents. I'm from Ekpara. So to contribute to the community, I said, okay, as a specialist, let me offer my own service to do this. And that's why we are screening, where we are giving free eye glasses through collectives, and we are going to do free eye surgeries for people. There are so many of them that have done one eye in previous, expenditures, previous eye health weeks. So we're going to do this. You see that the crowd is mammoth, but you can see there the product that we brought, the glasses and everything, and everybody is happy.
I have a last question, sir.
Go ahead.
And what do these beneficiaries stand to gain?
Oh, you see, when you are talking about blindness, when one person is blind, it affects 20 people, because somebody has to take the person around, somebody has to fetch for that person, somebody has to feed that person, and even the social impact that way you'll be discouraged. And I want to tell you that blindness has actually contributed immensely to causes of people committing suicide. About 0.3% of people that are blind, they commit suicide, so which is not too good. So with this very one, when they are integrated, they can now get feedback into the community. Instead of being dependent, they can now assist others, then they can now move around independently. Hence the need. So it's quite enormous and commendable. So it's very wonderful.
Thank you so much for your time, sir.
It's a pleasure. You are most welcome. God bless.